All right, summer means the kids obviously spending a lot more time outdoors, and they are all at a greater risk of coming into contact with poison ivy. Now, most of us just get a mild rash that can be treated at home, but some children get a severe rash that does require medical treatment. And joining us now with more is Dr. Ryan Redman, ER Director at Children's Hospital. Thank you so much for coming in.
Of course, thank you.
Let's just first start off with, a lot of us have these little catchy sayings, trying to teach kids how to avoid certain plants like leaves of 3, let it be. What do you tell people in terms of what they should look for out there in the wild?
Certainly, one of the big problems is that, especially when you're talking about poison ivy and poison oak, is that they kind of change appearance throughout the year. So in the summer they can be kind of reddish, in the spring they can be kind of waxy, and they can have kind of different looks throughout the year. So usually the good rule of thumb is if leaves of 3, leave it be.
And I said in the wild, it doesn't have to be out, in the Smokies or somewhere hiking. It can grow right in your backyard, can't it?
Absolutely, and usually these kind of plants like the edges of things, so the areas around a lawn, the areas around a parking lot. They don't do well in a dense forest, and they don't do well in an open field, so somewhere in those transition zones are where you really need to look for it.
What are the signs? A lot of people will be outside just playing and come back in with a little bit of an itch or something. How do you know if it's possibly poison oak or poison ivy?
Well, that's one of the problems, is that it can be kind of a delayed reaction. You can get symptoms that result from exposure up to 4 hours after, or even up to 4 days after it happens. So usually the telltale signs are going to be a intensely itchy rash with some clear vesicles that kind of ooze some kind of clear fluid.
Does that mean, if I've heard before, if you're kind of still oozing and you come in contact with someone else, can you spread poison ivy to someone else?
If the oil is still on your skin, it is something that you can transmit, but usually that oil will be washed off really well with just regular soap and water. So if you're at all concerned that you've had an exposure, the best thing to do is wash really well.
A lot of parents just kind of lather their children in calamine lotion or something like that to kind of keep it contained. Is that a good idea, and when do you know if that's just not enough?
So topical treatments actually work fairly well as far as the itching goes. There's not a whole lot that's going to make the kind of itching go away faster, other than if it's a really severe reaction. There are some times that we need to do an extended dose of steroids that will help with that. So if you get really bad reaction, especially on the face and the groin area, areas that are especially sensitive, then you want to see your doctor about that.
Yeah, we do have some images that we want to share now of what people should be looking out for, and for all intents and purposes, staying away from. If you do come in contact with this, or you think your child has, what is the very first thing you should do when they come back in? If they run back in and go, oh, I think I just ran through poison ivy, as a parent, what do you need to do?
So if it's within a couple minutes of exposure, using some rubbing alcohol on the skin will actually kind of take that oil right off and have your best chance of eliminating a bad reaction. However, if it's after a couple minutes, just regular soap and water, getting the clothes off, washing them in hot water. If it's something that you think it may have happened the day before and they've slept in their sheets, make sure that you wash those sheets and try and get anywhere that that oil could have gotten kind of cleaned up.
And you want to make sure it stays nice and clean so it doesn't lead to other infections or other problems as well.
Correct. It's not very common, but sometimes we do see secondary infections that happen as a result of any break in the skin. So redness, swelling, pus drainage, fevers, you definitely want to get seen for.
All right, Dr. Redman, valuable advice this time of the year. We appreciate it.
Thank you.